Executive Media. Focus, innovate, succeed.
Ikop bakube babifanani.
Olikwenda bifanani birungi. Bakukube bakwize eti oli munoni. Omukolo bagukolere.
Olina kwandula.
Olina nankani bya wedding.
Olina graduation.
Nibo bofirirwa. So kwenda kukola nankani send off decent.
Wesimbye omukalulu.
Decent.
Funaba Ikop.
Abo bulwo bayito batako.
Tubateko tuli kujja mukulonda.
Era tibasasula.
Be.
Kale.
Sasula.
Olikwenda bya bululu.
Yes.
Bakukube mukuba ni poster.
Ate bana.
Mukuba poster.
Olikwenda bana.
Bana dinedo kubutundu bali. Mu poster anguli mutunigira muko chali wife.
Ani. Chali wa imazira sente. Yasina n'okumuyamba oyo omusaada. Ikop.
Eri ekindi aba Ikop.
Olikwenda poster.
Kale.
Bana. Butundu bali. Billboard. Jamba na ife aba.
Business card.
Mudikola. Nti eno naba akole ne ya.
Ne debeta bolochuwa.
Bolochuwa dindi.
Bolochuwa chechimu. Ne business card.
Ate kalenda.
Muwandika ku t-shirt.
Follow us on Instagram at Ecop Photography or call +256 702 935 078. Don't forget, they do it smart. Book with us today.
And branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Cham Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
Airtel Extreme Unlimited Internet just got better. Paying for an Extreme Unlimited Internet connection now comes with free data, SMS plus voice minutes to call and text across networks for the Muganga who pays the monthly bill. Dial *125# or call 125 today
to upgrade to an unlimited, uncapped Airtel Internet experience.
Airtel.
The short and big shot.
Candle night ogimanyi. Bagita candle night gw'okutegwa bba.
Washuga teyamweganye ku live.
Vamo gyekiri. Vamo.
Bendera ddala.
Omusajja ate nga anaakuswaza ajja kwana black sugar.
Abasajja munyiga nga tebabati.
N'oyingira n'atakubuuza. Ekibonyaabonya ababooda abasinga. Financial literacy. Oli abeera n'etaano ate nagenda n'akwanamu. Agala mutabani wange wakati w'emyaka alina okuba ng'ekyalo akikuttemu ekitundutundu.
Anayakola kimpanya n'alagako nno panda nti si wa muzannyo.
Ate kye nayagala ku ttiimu ya Mama Fina.
Sente eziwaayo.
Naye tebasaba njawulo.
The short and big show. Abantu bajaagalira ddala. We always love you.
Yo, this is AFAS and I'm on Real Time with Mimi on Executive Media. Don't it. AFAS, I'm out.
Olunaku olwaleero nkomyewo ne Shamimu ku nsonga zaffe eza IVF. Shamimu njagala okumwebaza nti bwe tuzeemu ne tumuyita ajje tubeere nga ate tuwa a bigger picture ku maama oyo akoze IVF. Muleme kutandika kuba bakiyita batya kubeera nga mubamalako emirembe okugamba nti bamalaya ogamba nti bendera mu bufumbo like to clear the air nga tulina ne dokita akola ekintu kyekimu ekyo ekyakolebwa ku Shamimu ebibye ne bitavaayo bulungi. However ebyabasinga bivaayo nga birungi.
IVF is a newer specialty in medicine. It's not so new. It's been around from the 1950s. The first IVF baby was conceived around 1978 in the UK. And so currently, world over, there are over 8 million babies who have been conceived by the help of IVF. So it is a practice that really helps families who would like to have a child. There are different forms of IVF, and for us as specialists in the area of fertility and gyne, we start by assessing the couple. Okay, we want to find out this couple, what could be the main issues that are preventing them from conceiving normally. Okay, so we have an evaluation of the woman, and usually we want to check and see, is she producing eggs? Every month, can she produce eggs? And the evidence of that mostly is when she's able to have regular periods. So if a woman has regular periods, 98% of the times we are certain she's able to produce eggs. The second one in the woman we assess is the tubes, because fertilization takes place in the tubes. Yes, only in the tubes. So if someone has got blocked tubes, it means that person cannot, the sperms cannot meet with the egg, so this person
subira buli omu ali bulungi kamera
akulindemu omuntu bw'aba akola mulinde
badde ogamba ki wamma. Okay, kansubire nti muli bulungi yonna gy'otulabira, abatali wano, abali mu America, abali London, abali Sweden, Canada, Saudi Arabia, Oman, Dubai, n'abali wano ewaka ku butaka e Uganda. Njagala okubabuuzaako nti muli mutya. Njagala okutwala omukisa guno okubagamba Happy New Year. Happy New Year. Mwebale okubeera nga ate muyise bulungi mu 2025. Abalwadde mbasaasirako, abafiiriddwako abantu baabwe kitalo nnyo kitalo ddala. Fikfa Maker njagala okuyimirira n'okutegeeza nti nnumwa wamu naawe era njagala kugamba nti kitalo nnyo kitalo ddala ekyamaama. Shamimu Mayanja ly'erinnya lyange. Tuli ku TMR Hospital e Naalia. Olunaku olwaleero nkomyewo ne Shamimu ku nsonga zaffe eza IVF. Shamimu njagala okumwebaza nti bwe tuzeemu ne tumuyita ajje tubeere nga ate tuwa a bigger picture ku maama oyo akoze IVF. Muleme kutandika kuba bakiyita batya, kubeera nga mubamalako emirembe okugamba nti bamalaya ogamba nti bendera mu bufumbo, like to clear the air nga tulina ne dokita akola ekintu kyekimu ekyo ekyakolebwa ku Shamimu ebibye ne bitavaayo bulungi. However ebyabasinga bivaayo nga birungi. So munzikirize Shamimu ababuuzeeko then ne dokita yeyanjule. Dokita olulimi lwaffe luno Oluganda agenda kuba akozesa Luzungu nga bwe mbayambako okubannyonnyola mu Luganda lwe mugenda otegeera nti I'm not a normal person here. Yes. Yeah, doctor, I want them to know that you're going to be speaking English as I translate to those Ugandans who do not understand English. Tuli ku TMR akachai kajira mu budde. Ka esiku ekali. So Shamimu mbuuzako ku bantu tugende mu maaso.
Mbalamusiza mwena abali kuno ku channel ya Shamimu Executive Media. Mwebali kubeerako, mwebali reactions, mwebali feedback, abatusaasidde, abatunyoloddwa naffe Mwebale nnyo. Amanya nze Shamim namwe.
Dr. Ewad, greet them.
Thank you very
Then
much.
we go on.
Our dear listeners, thank you for tuning in and for this opportunity to share and to really try and understand what are the events that happened and perhaps help someone out there who is in this journey. My name is Dr. Eladu Emmanuel. I'm an obstetrician and gynecologist with interest in the area of fertility medicine, and I am here at TMR International Hospital.
Okay. So, Dr. nga bwe mumuwulidde akola ku bya fertility, igwe ayagala okukola IVF, igwe ayina ensonga ezikutawaanya nga z'abakyala. Ojja kujja wano ku TMR International Hospital in Nadia ate babeere nga bakukolako. So, Doctor, I have a few questions about IVF.
Sure.
I very well know that she also has some questions for you regarding her situation.
Yeah, sure.
So, I have some questions here, the reactions from what you know her experience.
Yes,
you watched the interview.
Clip,
Yeah, so we have a lot of people who are agreeing about IVF. And a lot of comments we had, people saying it can't be possible. It cannot happen. She cannot do an IVF and she come out when the kids are not hers at the same time. They are not for the man. So how is it possible? How is it done?
Thank you.
How can it even happen?
So, I think IVF is a newer specialty in medicine. It's not so new. It's been around from the 1950s. The first IVF baby was conceived around 1978 in the UK. And so currently, world over, there are over 8 million babies who have been conceived by the help of IVF. So it is a practice that really helps families who would like to have a child. There are different forms of IVF, and for us as specialists in the area of fertility and gyne, we start by assessing the couple. Okay, we want to find out this couple, what could be the main issues that are preventing them from conceiving normally.
Okay.
Okay, so we have an evaluation of the woman, and usually we want to check and see, is she producing eggs?
Okay.
Every month, can she produce eggs? And the evidence of that mostly is when she's able to have regular periods. So if a woman has regular periods, 98% of the times we are certain she's able to produce eggs. The second one in the woman we assess is the tubes, because fertilization takes place in the tubes. Yes, only in the tubes. So if someone has got blocked tubes, it means that person cannot, the sperms cannot meet with the egg, so this person cannot actually conceive naturally. Then the third assessment is in the womb. Can this uterus carry a baby? Okay, and then finally we assess the husband. We want to know, does the husband have semen? Does he have sperms that can fertilize the woman? So the journey of IVF starts with evaluation. Where is the problem? Okay, if we identify that the problem is with the woman, the next step is, can this be fixed? If someone is not ovulating every month, can we help them to ovulate so that we solve that problem?
You can also do that?
Yes, we solve that problem so that as well she's able to ovulate, and then the sperms can meet the egg. If the tubes are blocked, can we reverse this blockage? Can we unblock them? Okay, there are surgeries we can do to help to unblock the tubes. And then number 3, the uterus. Is it conducive to carry the baby? When we've finished the woman, we go to the husband. Does he have sperms or not? Are they enough or not? Okay.
There are some men who have.
Yes. So male infertility or male factor infertility is responsible for about 30 to 40% of couples who cannot conceive. So there's a very big percentage of men who actually are not able to help their women to conceive. And sometimes this can be out of a disease process, and sometimes can come even out of someone tying off what we call doing a vasectomy. Yes. So if you tie off the same way you tie off the tubes in the woman, you can tie off the tubes in the man, so that the sperms cannot cross over to reach the woman.
Okay.
And so we identify those two causes. Now to come to your point of, when we have found out, we discuss with the couple their problem and the best option. In IVF, you can use, if the man has got sperms, the woman has got eggs, and the problem is that these two cannot meet, we can help the man and the woman get their sperms and eggs and fertilize them from outside.
Okay.
Okay, so that is called the in vitro fertilization. It means fertilization happens outside of the body of the woman. Then after that baby has formed, then we put it back in the uterus. Okay.
So how do you keep the embryos?
Very good. So we have a special area. When we have harvested the eggs, we have harvested the sperms, there's a specialist called an embryologist. His work is to make sure that the sperms and the eggs that have been received are fertilized, okay? In a very special room or a lab where that process happens. So when the eggs have been fertilized, usually we can choose to transfer them directly after fertilization, or we can freeze that baby who has formed and then do what we call a frozen embryo transfer. Yeah.
Okay. So do you name those, like we do blood samples in the laboratory?
Yes.
Do you name the embryos and the sperms
Yes, so
to see that it's now Shamim and the husband going for IVF?
Standard procedure requires that every sample removed outside is labeled. All right? So the samples have to be labeled, and the samples have to be kept special, different from...
For those specific people.
Different from another person's sample, because you want to give the result to the specific person.
Okay.
Yeah.
So now, where do you mess up from?
And that is so it depends on the what we call standard operating procedures of the places that are able to conduct this IVF. Because when you get the samples and you don't label them properly, okay, so if there is a gap in how the sample is handled, in how the sample is labeled, then it is possible to have a mix-up in the sample. So it is very possible that the mix-up can happen from the point the sample is received, and maybe a different name is labeled on the sample.
Wow.
Okay, or it is mixed up in the storage. Okay, where the samples are stored, it can happen at that point as well.
But it can happen.
It is possible, although most IVF centers are really supervised, and in terms of standards, they are supposed to have very high standards of care, because these are human samples. These are specimens that you don't just get them anyhow. It's not like a blood sample. These are eggs that require preparation for you to get them. Okay? These are sperms that some men don't find it comfortable to actually get these sperms. And if the man has had a vasectomy, they have to undergo a procedure to get these sperms. So
are they still working?
So,
he has done a vasectomy?
Yes, and it depends. It depends. So when you have done a vasectomy, over time, because the sperms have stayed longer in the body, you end up forming what we call anti-sperm antibodies, which end up destroying the other existing sperms. So if someone wants to conceive, the earlier they have had the vasectomy and they want to conceive, they're likely to get viable sperms. But if the vasectomy has taken some time...
Like how long?
Most times over 5 years and beyond, then there is a special surgery that is done that can help us to obtain the sperms. You can do this, yes, you can do TESA, which is called testicular excision, okay, where you make an incision and then you expose the area where the sperms are stored and you aspirate that. You can aspirate and find nothing.
Oh.
Yes, you can also aspirate and find sperms. The only way of finding out is after aspirating, they are looked at in the lab to see if these are sperms that can be used for IVF or not. So in some people, you can aspirate and you don't find anything. And so it is the role of the hospital to inform the person that we have done this operation, we have got the sample, but in that sample, there is no sperm that can help us carry on with the IVF. All right?
Okay.
Yeah. So sometimes, and it can happen, maybe if the sperms are not obtained and the person doesn't inform, because for you who has conducted the procedure, you're hoping that there is sperm.
Yes.
Get it. So if someone doesn't inform you, then you will not know that the sperms are there or not there.
Is it the same thing happening with men with low sperm count?
So an ejaculation of a man contains over 400 million sperms, one ejaculation. But if a man produces less than 40 million sperms, okay, usually 39, 38, then that is a man who has a low sperm count because they have less than 10% of the sperm that is produced. So when you have a low sperm count, in terms of IVF, we can specifically get those sperms, and if the tubes of the woman are okay and she's ovulating well, we can actually put those sperms straight into the uterus. That is an IVF intervention called IUI. So that is intrauterine
you put
insemination
them direct. You
into
don't
the
keep
uterus.
them.
Yes. So we get the sperms, concentrate them, so that we directly put them into the uterus, so that the sperms can swim and then fertilize the eggs. If the sperms are very low, then that option would be a waste of those sperms. So then such a patient, we can advise them to do what we call intracytoplasmic sperm injection, where we get one sperm and inject it directly into one egg. So that avoids wastage. For IUI, we get the sperms, a number of sperms, and put them in the uterus. And we wait for them to swim and fertilize. But for this one, we get one egg, get one sperm, and fertilize it. So directly. Okay.
So with Shamimi's situation, why didn't they do the same thing? They got the sperms direct from the man because she was okay.
So it goes back to what was discussed during evaluation. And I think maybe Shamim, if she can, during the evaluation, there's always a discussion that is had on which option is the best and gives us the best outcome. Of course, if I leave the sperms to swim on their own, there is a chance they may not fertilize.
Oh.
Yes. But if I get an egg and I get a sperm and directly fertilize them, then the chance of fertilization is higher for that one compared to getting the sperms and putting them in the uterus and allowing the what?
There is a risk, eh?
Yeah. There may be reduced
chances
success.
Are low.
Yes, there may be reduced success compared to direct fertilization of the egg with the sperm.
Okay. So tukyagenda mu maaso nno luzungu mujja kutegeera nti kati munneetaaga nnyo ngenda bibannyonnyola naye mujja kunkwata bulungi. So kati soke tuleke dokita abawe mu luzungu ate nno ngenda bibatemera mu sekendi 2 nga nze mbimazeeyo mu Luganda. Buli omu ankubire. Yes. Bw'oba tobitegedde, you come to TMR, they explain. Not so, doctor? Yes. So, Shamim, olinayo kyonna kyababuuza doctor nga tetunnaba kumwongera bibuuzo by'abantu?
Yes.
People have been wondering, how is it possible that I give birth to kids that are not mine biologically?
Okay.
Yes.
All right. So again, it goes back to evaluation. And it's very important to know that whoever is going for IVF must go through evaluation. Like I had explained before, if a mother does not have eggs, okay, it means that the option for IVF is getting what we call donor eggs. I don't know if you get it.
Yes, yes.
Yeah. So from the evaluation, your doctor, your specialist should be able to know that you have eggs or you don't have eggs. And there are specific tests that we do that can help us to know if the eggs are there or not. Okay? If we do those tests and they show that you do not have eggs, then your doctor will suggest for you that since you cannot give us an egg, are you open to the option of getting somebody else's eggs?
To donate.
To donate. Okay? And there are people who donate eggs in IVF centers.
Oh.
Yes, there are people who donate
Yeah,
those
it's
eggs.
even here.
Yes.
But
So there are people who,
they give small money.
there are people who donate
They're cheating
eggs.
women.
There are people who donate eggs. And then it is now discussed with you that since you don't have eggs, you can opt for an egg donor. And then that is the egg that we can fertilize. If your husband has got sperms and they can be used, they can use your husband's sperm and they fertilize that donor egg. Okay? And then when the baby starts to grow, the baby is put back or transferred, the embryo is transferred back into your womb. And then that baby grows. That baby genetically will not have any DNA of the mother.
Wow.
If they use the sperms of the father, then that baby will have the DNA or part of the DNA of the father, but they will not have any DNA of the mother.
So, Shamimi's situation, they don't have the DNA of the father,
So
even
it
the
is
DNA of the mother.
biologically impossible for Shamim to have been the one who donated those eggs. Okay? If Shamim ever donated eggs, maybe they were not used. Because if the DNA shows that genetically, yes, the DNA was showing 0.00%, I looked at it. So if that is what the DNA is showing, it means that this there is no possibility that Shamim's eggs were used for fertilization. And if the husband is not able to provide for us sperms, we still discuss with the couple and say, look, from the assessment we have done and the sperms that we have got, they cannot be used for IVF. Are you open to the option of getting a donor, a sperm donor? Then we get the sperm donor and get those sperms, and then they are used for fertilizing the eggs.
So we use the word wrongly because obviously sometimes if the fathers are not cooperating well, we tell them that they are sperm donors. So a sperm donor donates sperms.
Sperm donor donates sperms.
Not that he's not taking care of the kids.
No. Yes.
I thought we have many sperm donors here. But
another challenging the question that they've been asking.
Yes.
That how is it possible that it is me who carried these children?
Yes.
Gave birth to them, breastfed them, but I don't have any
DNA.
biology. Yes. When it's me who carried them in my womb.
So anybody, and usually we have what we call surrogates. A surrogate or a gestational carrier, a pregnancy carrier. This is someone who we have assessed is in a very good health condition. The age is good as well for being a carrier. And then this is someone who is asked to carry a pregnancy for another person. Okay? If you fit the criteria and the assessment, you can be a surrogate. Okay? Normally for surrogate, with the scientific word of surrogate means you have provided an egg and you're carrying that pregnancy. But a pregnancy carrier or a gestational carrier, that is someone does not have any connection to the baby. They are just carrying that pregnancy. You get it? So if the womb is okay, you can carry that pregnancy. Yeah? If the womb is okay, you can definitely carry that pregnancy.
We are saying that because this person is growing up in my womb.
Yes.
The person is growing up in my womb.
Yes.
sharing blood, sharing a lot of things. How come they don't have any relationship?
They cannot have, because if the baby is growing in the womb, in the olden days, our grandmothers would breastfeed other babies who are not theirs. So breastfeeding is your body is conditioned to breastfeed. You get it? And especially if you have been prepared during the journey of the pregnancy, your body prepares to breastfeed naturally. Now, what you must understand that carrying this pregnancy does not mean that your DNA crosses over to the baby, because at no point does your blood mix with that of the baby's. All you're providing is food, housing, and oxygen to these babies. So there is no blood, none of your blood mixes with that of the babies, okay, until the point of giving birth. So meaning that these babies will entirely have a DNA. If you contributed to the DNA, they will have your DNA. If you never contributed to that DNA, you will not. It's impossible for even if you carried them for 9 months, it's impossible for them to have that DNA if you never contributed to the DNA. But the breastfeeding is very possible, because once the baby has grown, the breasts are prepared to actually produce milk. And once the babies are out, you will be able to breastfeed these babies. And this baby will still not have your DNA, but you'll be able to breastfeed the babies.
Then is there a way they can have like a resemblance
to
the babies,
to the mother
or the dad?
The babies, yes.
You know, physical resemblance is
Physical resemblance.
Physical resemblance it's not determined by you carrying the pregnancy. Okay, there is no.
Looking at maybe because you're having a relationship with a person, or you're married, and you're having sexual intercourse.
Yes.
During pregnancy.
Yes, during pregnancy. Is there a way it can contribute to like the physical appearance of these kids?
Not necessarily, because we know that the DNA is what determines how the baby looks. You get it, eh? The physical appearance that you have, that I have, is born from my DNA. So if genetically I'm carrying blood of someone who is light-skinned, then physically I'll appear light-skinned. You get it? If genetically my genes are for a tall person, then physically I'm going to be tall. So the genes determine how you appear physically, not the intercourse you have with a partner, and not because you've carried the pregnancy.
But you always tell the pregnant mothers to do intercourse, that it helps a lot.
You know, the intercourse, why we encourage pregnant mothers to have intercourse, is not so that the babies look like them or their father. The intercourse is normally in preparation for giving birth. Okay? Pregnancy should not restrict you from sexual intercourse. There are special people whom we tell not to engage sexually, especially if there is a threat to the pregnancy. There is bleeding around the baby, and maybe the placenta is on the lower part of the uterus. Those ones, we tell them, Neda, don't engage sexually, because you may end up bleeding and all that. But if everything is okay, then we do not prohibit
but it does not contribute anything to the looks of the baby.
No, it does not contribute to the looks of the baby.
Doctor.
Yes.
Amani gatuweddemu. Shall we go back to my contributing? Yes. So who to blame in this whole situation? Is it the hospital or the parents?
No, I think the parents are not really to blame, okay, because they went out to seek for the best possible option in terms of having babies. And I think anyone out there should be free to seek this kind of services wherever they can afford to.
Yes.
Okay. So now the onus is on us, the people who provide this service, to make sure that we have prepared these patients for this procedure. Okay? IVF is a journey that is tough. It's tough for the mother, it's tough for the husband. Most times when I'm encountering patients who are battling with or have struggles to conceive, you just know it has taken a toll on them. They have tried. They have tried on their own. They have gone to pharmacies. They have tried herbal concoctions.
Yes.
They have tried prayers. You get it? They have tried. So you find that it takes a toll on the couple. It takes a toll on the mother, okay, on the woman. And
so how is the procedure? Can you please elaborate at least a bit of the procedure they go through?
So after we have evaluated, like I said, it's the foundation of IVF. After we've evaluated, then if we think that fertilization can't happen naturally, then we suggest for them for IVF. The first part of IVF is being able to get eggs from the mother. If she's able to give us eggs, we prepare her. And that preparation to get eggs involves injections.
Wow.
Okay? There are injections that we give this mother to make the eggs ready. Okay? These injections are usually given on the second or third day of the periods, and then another one may be given around the 10th day or 12th day of the period, okay, to prepare the eggs. And then this mother is taken into a scan room where, or an area where the eggs are harvested. It could be a theater, the eggs are picked.
How do you harvest them? You just...
No, we use a special scan, a scan that is able to visualize the uterus. We use a transvaginal scan. And then we also have a special needle that is able, we usually put it alongside the scan just down, and then we're able to harvest these eggs. Because when the scan is transvaginally, the ovaries are near the scan, so we're able to aspirate and get the eggs and then put them in a special container that is able to preserve them. Then we now go to the husband and advise him to provide for us the sperms. The sperms, if the man has no issues producing the sperms, we can either encourage them to masturbate, or we can encourage the wife to help the man to be able to produce the sperms. And usually the sperms are received within 1 hour, okay, of that process, so that we can analyze the sperms and then obtain the best possible sperms for the process of IVF. Then after that, we cause the sperms and the eggs to get fertilized. Now, during that time, we now start preparing the mother.
How?
By giving her still medications.
Wow.
Injections and tablets. Okay.
For how long?
And this preparation depends on how soon the transfer is. There are those who prefer to have the transfer happen immediately, so it can happen within 2 weeks. Then there are those who we can give some time, 1 or 2 months, prepare the mother and make sure she's in the best state possible.
Mugumba tasubira kufuna baana essubi lyamuggwamu kan asobola okugenda ku IVF n'afuna essubi erizaala oba erifuna omwana, oba it's not possible because aba alina amagi, alina uterus. Can she come for the IVF?
Yes. Yes.
Oh, wow.
Yes. So like I said, if someone is barren, by barren we mean, maybe we need to define what barren is. Yes. But if you mean this person, because if you cannot produce eggs, so if you've reached menopause.
Yes, menopause.
So if you've reached menopause, it means that the IVF we are going to suggest for you is not for using your eggs.
Donation.
Yes. So we will advise you to opt for someone or an egg donor, or get eggs that have been donated. And then we will fertilize. If your husband is okay, if you discuss with your husband, we can use your husband's sperm. If the husband can provide for us sperms, fertilize the donated egg. When the baby starts to grow, prepare you and transfer that baby into your womb. And then you can carry that baby.
Wow.
Okay.
So again, it's the same thing with the barren ones. Agamba nti obanze sina magi oba agange gagononeka.
Yes.
Abeera naye afuna donor.
Yes, so the best option is usually a donor.
But ne bakozesa sperms za bbaawo.
Yes, if the husband has sperms.
The difference is that they're using someone's eggs.
Yes, eggs. But the husband has sperms, then definitely we'll go with those sperms of the husband.
Oh, so omukyala ali eyo nga magi tolina, dokita annyonnyodde bulungi nti osobolera ddala okubeera nga ofuna dona akuwa amagi naye ne bakozesa spam za bbaawo ne mufuna abaana. Ndowooza ekyo mukitegere. So do you do IVF from here?
We are in the process of setting up the IVF unit. Currently, what we are doing as a hospital is we evaluate and then we counsel and guide couples who are seeking for IVF treatment. We give them their options and we're able to guide them to already existing IVF centers in the country. Those ones that are very good. Yeah, so but within a few, maybe 1 or 2 years, we should be having our own unit that actually is able to do that within the hospital.
Oh. So how much is it? Like, how much is it to do an IVF?
IVF can be as low as 3 million. Especially depending on what is causing the difficulty in conception or the infertility. Okay? For those men who have reduced sperm count, okay, and especially the wife is okay, the eggs are okay, the tubes are okay, the uterus is okay, where we harvest the sperms and put them direct into the uterus, that is the lowest cost of IVF, known as IUI. And most the facilities that offer IVF charge between about 3 to 5 million for that to be done. Okay, for those men who have maybe the sperms are of a low count. Okay, but so depending on what is causing the IVF, if we have to harvest the eggs and harvest the sperms and fertilize them from outside, that is going to be more costly because of the treatment that is taken by the couple, by the woman, the medications the husband may have to take. So that usually ranges. On average, the current cost goes for about 15, 18 million. Okay, for that to happen, and can, depending on really what is causing the infertility, can even go up to about 24, 25 million Uganda shillings. Yeah, but so importantly, see the fertility specialist or see the obstetrician. Let them find out where the challenge is.
Yes.
Because if the wife has no problem, she has eggs, but the problem is with the husband, we can just get the sperms and fertilize and push them into the uterus, and then you pay less than 5 million for that to be done.
Okay. Yeah. So Dr. tulinawo bamama nga yafuna ectopic.
Yes.
Ectopic oluseke ne balusala.
Yes.
The same situation nafuna ectopic endala. N'atayangu agenda mu ddwaliro era oluseke olwokubiri ne balusala.
Yes.
Ate bwe wabadde nnyonnyola wali wagambye nti oluseke tubes.
Yes.
Nti z'amaanyi nnyo mu kufuna olubuto. So singa nfuna ectopics 2 ne banzija mu tubes zange, mba ngenda nange ku IVF.
Yes.
Amagi mba nkozesa gange.
Yes.
Kyemba nzigyeko ye tube.
Yes.
Naye mba nkyasobola okujja ne nkaringa abaana bange.
Very, very well. Because as long as the uterus is okay, your ovaries are okay. And even if they remove the tubes or they tie the tubes in an ectopic, osigala ng'ofuna periods, you still get periods because the ovaries still have eggs.
But again, you tell us that those tubes help us to okujjayo ebikyafu biki if I don't have them. Ebikyafu biddawa. Where do they go?
The tubes,
like when I'm menstruating now.
So the tubes are very important for mostly fertilization.
Wow.
That is the only place fertilization takes place, in the tubes. Anyone who has blocked tubes or ectopic will struggle to conceive naturally because there is nowhere the sperms meet with the eggs. The eggs don't swim down to the uterus to meet the sperms, no. The eggs are usually graceful. If you have tubes, they will come and wait in the tubes. So it is the sperms. That's why you see sperms have tails. It's the sperms that must swim all the way to where the egg is.
But they pass through the tube.
They pass through the tube towards the end of the tube where fertilization takes place. So if someone has got an ectopic, and I usually want to for those who have had one ectopic, you still have a functioning tube. You should not worry.
But it is risky?
Yeah, so make sure that you avoid especially STIs and recurrent UTIs because those are the infections that climb up to the tubes and affect the tube and make the tube to form scars and therefore block the tubes. Okay? Those are usually the triggers that cause the tubes to be blocked.
Doctor, I need to come back and you give me another interview about infections and STDs when I'm not disturbing Shamim.
No,
because I don't know how we are going to avoid the STDs and UTIs. And again, with this situation, you have a lot of mothers with ectopic.
Yes. So the ectopics are there, and currently we have better modalities of dealing with ectopics. Now, for an ectopic, if you come early before the tube has ruptured, we can actually give you medicine that can help the ectopic to disappear without cutting your tube.
But do you think we know that it's an ectopic coming?
That means that as soon as you are not seeing your periods, do a pregnancy test. Number 2, do not wait for 3 months to come to hospital.
If you're not seeing the periods.
Within 1 to 2 months, and you think you're pregnant, come. We do a scan and find out where is that baby located. Because if the baby is located in the tube and it has not yet burst, we can give you medicine and then that tube can be saved. But also, if the tube is beginning to get affected, currently we do laparoscopic surgery where we can use cameras to see the tubes, remove that pregnancy, and try to repair the tube.
Oh, it can be repaired if you come early in the hospital.
If you come early. But if you come when you've bled so much and we need to save your lives, most likely we will just remove the whole tube.
Wow.
And if someone has got one ectopic and they get another one, most surgeons who are trained to conduct laparoscopic surgeries will try to save that tube. They will try to intervene and then try and save the tubes.
Okay.
Doctor, maybe what I can ask you,
Yes.
because in my story I told people
Yes.
that I carried 3 babies.
Yes.
But along the way, it dissolves. And what happens?
Omwana abula atya nga nina abalongo ne baŋŋamba wanzadde omu ate owookubiri simuwe yabuze mubuze abaana
So
ekirala alagawa bw'aba abuze.
Okay. So when a baby is growing in the womb, if it is one baby, they do not have competition for resources. If it is more than one baby, they have to compete for resources. Okay? So for IVF, that's why we normally don't just put one baby in the womb. Okay? Because to help improve the chances of success, we put at least 2 or 3 embryos. In the olden days, we would put 5, 6, but we realized that the outcomes of pregnancy are poor when there are more embryos. So now we put about 2 or 3 embryos and then allow for them to grow. Okay? In that growing, all of them can successfully grow. So you end up having triplets. But in some scenarios, you may find that maybe 1 or even 2 fail to grow. Okay? And that means that the one who is left will be the only one to grow. When we say fail to grow, if the baby doesn't get enough food, because this baby must attach itself onto the wall of the uterus and then start getting food from the womb. If that process doesn't happen well, what we call implantation, if it doesn't happen well, then that baby cannot get food, that baby cannot grow. And if that baby doesn't grow, slowly you will start shrinking because it's not increasing in size. It starts shrinking and then it vanishes.
Alagawa.
Because normally it just gets dissolved within the wall of the uterus.
Abulira mu lubuto lwange.
Yes. But because these are cells, these are very small, but there are no bones, there are no what. So if that baby is can't even see with the naked eye. So that is something that can dissolve and then...
So you don't get periods when...
No, you don't.
The baby shrinks?
You don't. As long as the other babies inside, we expect them to the other ones will continue growing while this one...
It happens normally?
Yes, it can
and life
happen
goes
normally.
on?
And life goes on.
You know, I've seen things with Shamemi's story. I didn't know that the baby can dissolve.
Yes.
What I knew, you can get a miscarriage.
You can even get twins, and then one of the twins outcompetes the other twin.
How?
By taking away all the food.
Oh.
Yes. So even twins...
They're always in competition.
Because they need the resources within the womb. You get it?
So which means the mother aba inokulya ennyo. N'okunywa ennyo bonna abawe.
It's usually the dynamics of the uterus. The uterus should be able to allow all of them to grow. Okay? And in some areas of the uterus, maybe if that doesn't happen, then that baby doesn't grow from that area.
So omulabi waffe wa executive media njagala kusaba wano dokita nga mwenna muwulira atuweeyo olunaku batusomese ku UTI ne STDs bwe tuyinza okuzeewala okubeera nga tetufuna bizibu bingi. Then njagala okumusaba atusomese ku ectopic because it is becoming now a problem to mothers. Ectopic ejetya happening zitya because ectopic see a miscarriage again. They are not the same.
They're different.
Yes. So atwawuliye wakati wa ectopic ne miscarriage. Yes. So doctor tugenda kumusaba naye mujja kunoonya mbannyonnyola ebintu bino byayogedde mu Luzungu but bwe tutematemamu ababadde beebuuza ku bintu bya Shamimu kibeera kitya kiyinzika kitya okubeera nga talina DNA y'abaana ne taata nga talina. Dokita annyonnyodde bulungi nnyo nti abo baba bamuwa amagye agatali gage. Baba bamuwa amagye agatali gage ate n'agamba okwegatta tekulina kuleetera baana kufaanana ggwe. Kwegatta just olina nnyumirwamu naye dokita agambye mukwano tebirina we bikwataganya na mwana kufaanana. So you can do the intercourse but please don't think mwana agenda kufaanana ennyindo. DNA oba wagikola dda. Magina spams. Kira kirala kye nnina obbannyonnyola dokita kyagambye. Dokita agambye ku ectopic wenna gwe baasala oluseke nga baakusala oluseke bw'oba olina olwokubiri lukuume bulungi nga tofuna UTI tofuna STDs osobole okubeera nga ate ozaala bulungi. Naye n'agamba gwe baasala enseke ebbiri you can do an IVF ate n'ozaala bulungi kuba oba olina amagi nga n'omwami wo waali. So omukyala ali eyo nga baakusala enseke zombi like togenda mu depression. You still have an option to live and to have kids. Then Shamimu bamutekamu abaana basatu omu n'adissolvinga nafunye comments nga 10 nga buli omu agamba nze nalina balongo babiri omu n'adissolvinga bonna babiri ne babula. Dokita akinnyonnyodde bulungi nti babeera mu uterus nga balina competition y'okufuna ebibabeezaawo. So omu bw'atafuna asobola ddala odissolvinga naye kisobola osigala n'asigala ng'oli nnomo. So omwami ali eyo tugamba nti omukyala olubuto olumu yaluggyemu n'asigazaamu babiri. Yes, twetaaga ali eyo njagala olabe program eno naddala abaami nga tonnagamba nti omukyala yayenze wabula nga dokita agenda njagala mmubuuza can it happen when they do IVF nga maama alina DNA y'abaana nga taata talina? It can happen still?
If the sperms that were used were not for the husband.
So can the hospital decide for the mothers without even telling them?
The hospitals are not at liberty to do anything without telling you. They are supposed to explain to you. If
Before
they don't do
anything.
that, then it is wrong on their side. You get it? You're not supposed to carry an embryo that you are not aware of.
Yes.
You get it? And I know usually IVF is medical legal. So most times, if they explain something to you and you accept it, they will ask you to sign. Okay?
Yes.
And I usually encourage IVF patients, read these documents. Read them, and on top of that, get a lawyer to read these documents. Because you could be signing
something
you don't know. You may find I've included there that if we are not able to use your eggs or get your eggs, we are at liberty to select for you.
Oh.
You get it? So make sure you read these documents clearly, understand them, ask where you don't understand, and get a lawyer to help you interpret this. Because it's possible that in their attempt to try and help you to get a baby, they end up using someone else's embryos. You get it? And sometimes we have embryos there that maybe the owner has not picked. Some people come and freeze their embryos and say, Kale, I'll come back after 5 years. You get it? Yes.
Never know.
There are people who freeze embryos and come back after 10 years and say, now I had left 2 of my embryos there. Can you transplant? Can you transfer
them? They can
them?
be freezed for over 10 years?
You can freeze them for even over 50 years.
Okay, so njagala kwebaza TMR International Hospital nebaze ne Shamimu okukkiriza okuvayo ku lw'abamaama abakola IVF okubalaga nti kye bayitamu baba tebakyeyagaliza but embeera ebatuusa olumu kiyinza okuba kiri ku mwami we nga gweyagala obeererawo olumu kiyinza okuba kiri ku ye nga omukyala nga n'omwami yagala beererawo mukyala we. TMR waneeno ekkiriza era neetuwa bulungi nnyo okubanga bagenda kuba bajjanjaba abaana baffe abo be mwagala ennyo okulaba be tutagenda balaga. Yes, professionally we cannot show you the kids because mujja kuba malako emirembe but TMR etuwadde okubeera nga abaana buli obalwalira bakwano bagenda kubeera nga ate baba tujjanjabirako sa ne maama. Naye so fans tebandowoozezaako nnyo kiryawo naye yes but Shamim and the kids are okay. Anammwe mwenna abamukubidde ku ssimu abankubidde abamunoonyezaako kimeninga kitegeeza kinene gyali but Shamim wanted to talk to that mother yakola IVF we yali ajja specifically ensonga ye yali yakwagala kugamba maama ali eyo nti ngyakirimu naye akiyitamu. Nze just njagala bugumu obwo. Shamim, thank you so much. Thank you so much, Doctor. When can I come back, please, for the interview about UTI, STDs, ectopic and miscarriages?
Yeah,
they really need that topic, please.
Absolutely. I will be ready. I think we can plan for that.
Dr. Dennis?
Yeah, Dr. Dennis and maybe Dr. Daniel.
Yes.
This week, tomorrow I'm around as well.
Okay.
Usually I'm busy on Tuesdays, that's why I think. So Wednesdays I'm not busy, Thursdays I'm not busy.
Okay.
I mean on Fridays as well. So we can plan and then have a session to really educate people because people are out there.
People
they don't know what can be done.
Yeah.
And we have better and newer technologies. For example, for ectopic, there is no reason for you to have a cut because of an ectopic. We can just
we have cuts.
We can use cameras. That's what I'm saying. That
to do it?
Yes, we can use cameras and then you you stay when there is no cut on your stomach. You just you look very very nicely. So when you get these ectopics, don't be in a hurry. You can come to TMR and other real hospitals that have these technologies, but we have laparoscopic surgery and we can do that at a very affordable price. And you go back home almost the same day or you stay in hospital for just one day. Yeah. Even for people who have blocked tubes, we can unblock the tubes. Laparoscopically, we can do that surgery. People who have...
But they said it's too painful unblocking them.
No, because they are not doing it using laparoscopy. People are doing it blindly. They flash medicine through the tubes. But now we can actually use cameras and then we are able to see where the tube is blocked from. We're able to unblock the tubes and then people go back home and actually conceive after that. Those who have fibroids, we are still able to do that without you going home with the
But they come back, the fibroids. Then at that interview of fibroids.
We shall have it.
Doctor, because they say if they do the operations, they usually come back. Bizarre.
So the fibroids are in about 3 to 10% of women who get surgery of fibroids. Some can get recurrence. Okay.
10%.
About less than 10%. But what that really means is that fibroids grow as long as ochafuna periods. As long as you keep getting periods, there is a risk. There is a risk. The hormones that cause you to get periods are the same hormones that make the fibroids to grow.
Doctor, I need another interview on that. Doctor, tugenda mubeerako nnyo kuba twetaaga fibroids ate abo bo nina bayitirivu and at the early age like 23, 21 they're having fibroids, many of them. Ne babagamba balinde bamala okuzaala bijja genda babalongoosezza bikomyewo abamu babajje ku nnyama like they are not supposed to eat meat like everything. I'll have a full interview about fibroids. So munzikirize nte Shamimu adduka asanga abaana agenda akole emirimu gye abaagala enamba ya Shamimu tujja gibawa oyo anaabazze mu inbox for security purposes and for the safety of her and the kids. Kyova olaba nti tuteekawo okwo ku protocol obutonotono okufuna enamba ye naye si kajanja oba ki but she also needs her privacy in return. But thank you so much, Doctor. Thank you TMR Hospital. Thank you Shamim. Nammwe abalabi mbeebaza nnyo mwebale nnyo mwebalire ddala n'abawagira TMR International Hospital nammwe abanjagala happy new year.
Executive Media. Focus, innovate, succeed.